So we talked a little about heart sounds, heart murmurs. We talked about how they're systolic and diastolic, and you can tell that regurgitative murmurs are blowing type murmurs. We talked about how murmurs at the mitral valve will be louder, best heard at the mitral area, and murmurs at the aortic valve will be best heard at the aortic area. But sometimes you really just can't tell which murmur is which, and which is why we need heart sound maneuvers, which will decrease or increase various heart sounds and help us narrow down what is the pathology. So inspiration we talked a lot about, but the physiological action is going to be increased venous return to the right side of the heart by decreasing intrathoracic pressure. And you're going to there's more blood is going to stay in the right side of the heart, and there's going to be less venous return to the left heart. So what happens to the right-sided heart murmurs? If there's more blood flowing through the right-sided heart valves, then you're going to have increased murmurs. It's going to be louder sound on the right-sided heart murmurs. If you have a left-sided heart murmur, then there's going to be less blood flowing through those messed up valves, so the heart murmur on the left side will be not as loud. So next is hand grip. What does hand grip do to your physiology? What happens is it increases afterload. Okay? It's kind of tensing your hands, you're tensing your blood vessels, and so there's increased afterload, there's increased resistance. So what will happen to your regurgitative murmurs if you have increased afterload? So that's like aortic regurgitation, mitral regurgitation. Well, those increase. You have increased intensity of those regurgitative murmurs, because blood is not going to want to go into the aorta as much because there's increased aortic pressure. So it's going to go through that. It's going to go backwards. It's going to go back into the left ventricle. It's going to go back into the left atrium. Same idea for the ventricular septal defect. Okay, it's going to, instead of going out of the aortic valves, it's going to go through that the defect in the ventricular septum, and go from the left ventricle to the right ventricle. So that makes total sense. Then hypertrophic cardiomyopathy will decrease. That murmur actually decreases with increased afterload, and because there is increased left ventricular volume. I want to explain how that works. And then aortic stenosis murmurs will decrease because there's increased afterload, so there's going to be less blood flow through those aortic valves into the aorta. So standing or Valsalva. So Valsalva is something like coughing, asking someone to cough or push like they need to poop. And what this does, standing you can just pretty much tell. Standing means that you're increasing the gravitational effects. So what happens to venous return and preload? That's going to decrease because gravity is going to prevent the venous return from flowing up into the heart. So you decrease preload, and you also decrease afterload. What's going to happen to your murmurs? Well, your hypertrophic cardiomyopathy and mitral valve prolapse murmurs are going to increase, and that's due to decreased left ventricular volume. I'm going to explain that in a picture in a little bit, so keep that in mind. The other murmurs will decrease because you have decreased blood flow through the valves. There's less blood in the heart because of the decreased preload. Less blood means less blood flowing through the valves, so you quieter murmur. Finally, we have the rapid squat. Rapid squat is basically doing the opposite of standing. Instead of standing, you're squatting back down, so physiological action will be opposite. So that means you have increased preload and increased afterload. So preload, you're going to facilitate the return of blood flow to the heart, increasing your preload. And thus your heart effects on heart sounds will be exactly the opposite. So now I want to explain this. I want to explain how the mitral valve prolapse and the hypertrophic cardiomyopathy heart murmurs change. So we're going to talk about mitral valve prolapse. When we are standing, this is how it looks like. We see the mitral valves, they're prolapsed, and there's space between them, so you can have regurgitation. And so blood will flow back out of this into the left atrium, and that's going to cause the murmur. But when you squat, you're going to you're pushing pressure, you're squeezing. Remember, you're squatting, you're increasing that preload, you're increasing that left ventricular volume, and it's going to push out like that. And this is actually going to bring your mitral valves closer together. And so even when they prolapse, there's going to be less leakage into the left atrium. Okay, so if there's less leakage into the left atrium, then your murmur is going to decrease. And that's because when you squat and you increase that left ventricular volume, that's how it's going to bow out into. For hypertrophic cardiomyopathy, larger left ventricular volume means more space in the left ventricle. Remember, the problem here in hypertrophic cardiomyopathy is you have this mitral valve here that's obstructing your flow. So blood wants to go through here and has to go through that mitral valve. When you have a larger left ventricular volume, for example, when you are squatting, remember that increases venous return. You see that we have increased the volume and now there's more space. And when we have more space, we have less blockage. Less blockage means that blood can flow better and it's going to be less murmur that occurs. So that is how all of these different maneuvers change our heart sounds. I hope that a lot of these make sense, especially once you understand the physiological action, and you'll understand how changes in preload and afterload will affect blood flow across these messed up valves. Alright, so that's it for this lecture.